Subconjunctival hemorrhage after intravitreal injection. Hopefully we will have a mixture of interesting clinical findings and signs in this video. So first of all, let's think about subconjunctival hemorrhages. What's your approach to patients like this? I mean, generally we want to reassure patients that this is a benign finding, it's something that isn't anything to worry about, but it should resolve on its own. Now the main things that I do is I always ask about medication history. Is the patient taking any blood thinners such as warfarin, apixaban, edoxaban, rivaroxaban? And also, does the patient have a history of high blood pressure? So I always measure blood pressure in patients with subconjunctival hemorrhage. Now, let's look at this patient. There's a corneal scar and there's a subconjunctival hemorrhage. What else is in the history? Now, you need to ask the patient, have they had any recent surgery, any recent procedures, any recent trauma? And if you do that, in this patient, you'll find out that this patient has a history of choroidal osteoma. So this is a 62-year-old man who has a background of choroidal osteoma, and one of the complications of choroidal osteoma is choroidal neovascular membrane. And that's exactly what this gentleman has, and he is being treated with anti-VEGF medications for this because of this condition, and he'd recently, 3 days ago, had an injection, and after the injection he had pain, irritation, and the subconjunctival hemorrhage is as a result of the intravitreal injection. Just the needle going in, accidentally puncturing one of your subconjunctival blood vessels and causing this traumatic subconjunctival hemorrhage. So let's see if we can see that on this video here. Patient's obviously blinking quite a lot, but you can see it looks like a bit of a myopic fundus, tilted optic disc. And there you go, you can see that classic appearance of that choroidal osteoma, that whitish area there. So I hope you found this video useful, and I hope it's interesting to see choroidal osteoma, but also have a structure in your mind for how you're going to approach a patient with subconjunctival hemorrhage. The most important thing is generally just to reassure patients. And one of the things I tell patients is, look, I've had it myself before, and that tends to reassure people.